Welcome back, everyone. My name is Dave with Lifetech Instructional out of Palm Harbor, Florida. In this video presentation, we're going to go over adult CPR. Now, hopefully you got to enjoy our previous video called Introduction to CPR. Why CPR is so important? Why do we do CPR? So here we're going to demonstrate adult CPR. And we're going to kind of throw some of the details in there of why we do certain techniques. So one thing with our mannequin that we are using right here today, we need to make sure that the scene is safe for you. Don't put yourself in a dangerous situation. Now, we need to check for response. Now, checking for response is tapping on the person's shoulders. Hey, 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 are you okay? Are you okay? Are you okay? From there, we're going to find out if they're responsive. And one way of doing that is providing the look, listen, and feel for breathing. So you're going to place your cheek over the person's face. And while you're looking down towards the chest, we look for chest rise. Do we feel any breaths or listening for sounds of breathing? So we look, listen, and feel for breathing. Yes, of course, if there's no response, shout for help, call 911, point and designate for someone to call 911, but also have someone grab an AED defibrillator if it is available. But always never assume that someone's calling 911. You might have to point and designate for someone to call 911. If you have a cell phone, put it on speaker, place it down next to you. You want to make sure that the adult is on a firm, flat surface. Expose the chest the best you can. What that means is that in some cases, you may not be able to expose that chest. You may not be able to rip the shirt off somebody. But with guidelines now, we don't have to worry about getting the outfit off. All you have to do is get your hands on that person's chest and start doing those compressions. Now, when it comes to the compression side of it, with a guideline, they say that you're supposed to place the heel of your hand in the center of the person's chest between the nipple line. So on this mannequin here, if those are the nipples right there, we place our heel of our hand right in the center of the chest, right on the breastbone. Now you place your other hand on top of your first, or you can interlock your fingers, or also you can place your hand on your wrist, whatever is comfortable for you when you're doing CPR. You also want to make sure that your shoulder lines up with the heel of your hand and keep your arms locked. If I keep my arms bent, I'm going to wear myself out, but my depth of compression is not going to be effective like it should be. Now with the guideline, they say that you're supposed to compress down 2 inches on the adult's chest. But let's put this into reality perspective for a moment. How do we really know we're going 2 inches on someone's chest? Do you have a tape measure? Do you have a ruler stick? How can we really determine if we're going that deep on someone's chest? Reality in real world, you push hard and you push deep on that chest because each and every one of us have different strengths of what we do. Now, also when you're going to compressions, you want to make sure that you don't bounce on the chest. You don't want to rock on someone's chest. All we're doing is using our upper body strength to push on that chest, hit that heart, and hopefully get that blood and oxygen pumped to the heart to start perfusing the person's brain. So as we're doing our compressions, you're going to be providing straight, continuous compressions. Now, in the beginning, this is just hands-only CPR. When you call 911, dispatchers will tell you to do straight, just non-stop compressions on someone's chest. So when you're on the chest, we're going to push hard, we're going to push deep, and we're going to push fast. But some people say, well, I don't know how fast to push. Well, as a guideline, they say that it's supposed to be 100 to 120 compressions at least in a minute. But let's put this into a reality perspective. Who's going to count? Who's look at their watch? Who's look at the clock on the wall to see if that person's doing that many compressions? The reality of it is, we all have different speeds. We all do it differently. Get your hands on the person's chest, you push hard, you push deep, and you push fast. So as we're doing our compressions, like I said before, we're going to be providing continuous compressions non-stop. Sometimes you might be doing over 600 to 700 compressions on someone's chest, which is about, in our previous video we said, the oxygen in the adult lasts for 4 to 6 minutes. So as you're doing straight compressions, okay, that's all you're doing is pushing hard, pushing deep, and pushing fast. But let's just say that EMS is not on scene yet. Like we said in our previous video, that sometimes EMS systems take a little bit longer getting on scene. It depends on the city or the county where y'all live in. So what happens if they start turning blue and purple in the face? That means they're losing what? They're losing oxygen. So the only way they're going to be able to get oxygen now is providing some breathing. So we need to open the airway, establish an open airway. What we need to try and do is move the tongue away from the back of the throat so that we can establish that airway so we can have our air go in. So with an airway, you place the heel of your hand on the adult's forehead and other hand on the bony part of the chin, and you lift. Now, it is not wrong for you to place your other hand underneath your neck if you wanted to lift. Sometimes it might be easier. But that is your airway. That is considered the head tilt chin lift. Now, when it comes to the breathing part of it, as a guideline, they say that you're supposed to give a nice full breath to an adult. But let's put this into reality perspective. How do we really know that we're breathing deep enough? And the only way that we know is that if we see the person's chest rise. Because each and every one of us, we breathe differently, don't we? We all breathe differently. So the only way that I know in reality that my breath is going to be effective is looking for that person's chest rise. Now, it's not recommended to do mouth-to-mouth breathing, but there's some adjuncts you can use. You could use a cotton shirt to put over someone's mouth. There's also some things called a little barrier shield, which is a piece of plastic with some cotton that goes over the person's face, with the cotton part going over the person's mouth. There's also a thing as a mask. So instead of you pinching the nose, all you're doing is using the mask that's going to do it for you. The other part area is going to go over the mouth, and it has a little tube that you're able to breathe on. But sometimes you may not have this. So sometimes you may have to do mouth-to-mouth breathing on somebody in some cases. But you got to make sure that it's safe to do so. So as I'm doing my breathing, we're going to do just the mouth-to-mouth method itself. So you want to make sure you pinch the nose. Why do I pinch the nose? So that air doesn't come out of the nostrils itself. You want to make sure that air is going in. So the head tilt chin lift, pinch nose, give your breath. And as you give your breath, you should be able to see the chest rise. Now when it falls, you give your second breath. You breathe. After the breaths, you go right back and doing your compressions. Now the compressions we're going to be doing 30 compressions, followed by 2 breaths. 30 compressions, followed by the 2 breaths. And continue doing CPR. If you are using the mask, thumb and forefinger will go on the top of the bridge of the mask. Your thumb holds the bottom, 2 fingers on the chin, and you give your breathing. Chest rise. When it falls, second breath. And then start doing your compressions of 30 compressions. If another person is available, ask them to help. They're sharing responsibilities. If an AED or defibrillator is available, they're going to turn it on, follow the voice instructions, and that is going to be in our other video presentations when we go over the automated external defibrillator or an AED. If the adult starts to breathe, cough, or vomit, you want to make sure you place them on their left side to help protect their airway. We want to make sure that if any secretion's coming out, we just don't want them to aspirate and it goes in the lungs itself. Ladies and gentlemen, that is adult CPR.